Hi, everyone, and welcome back to Damn Parenting, your English-speaking parenting podcast from Amsterdam. And hopefully you know us by now, but if not, we are your hosts, Maren and
Eva.
Today, we have another celebration day. It is World Oral Health Day or World Oral Hygiene Day. In any case, you have to take care of your teeth. And because there is a lot of opinions about this topic and a lot of anxiety, at least from my side, and I guess also from your side, right, Eva?
Oh,
You
God,
also
every
had
parent.
yeah, I guess we can speak for everyone. There's a lot of anxiety about the teeth because not every child is super fond of getting the teeth brushed. And then it's a discussion of which battle do we want to fight? Do we want to really push the brushing now? Or how many of these, all right, we'll let it just slide days can we have? We are super thrilled that we had a pediatric dentist come on. Her name is Kelly. We just dropped a bunch of questions on her, and she was super patient, calm, and reassuring, answering all of them. So hopefully this will be an episode where a lot of questions can be cleared up, a lot of opinions can be cleared up. We did hide 2 golden nuggets of wisdom for you at the very end of the episode, so you have to sit through it to get those 2 special tips that Kelly has to share with you. If you don't take anything away from this episode, these 2 things are to remember in order to keep your children's teeth healthy and establish a good routine for a good oral hygiene. So let's jump straight over to Kelly and let's see what the 2 important tips that she has to share are. Enjoy.
And without further ado, we'd love to welcome Kelly. Hi, Kelly.
Hi,
Hi. So first off, please introduce yourself, your background, and your profession.
I'm Kelly Lazaridi. I work as a pediatric dentist at the referral practice in Amsterdam. I'm excited to be here, not only as a dental professional, but also as an expat mom.
So you're living in Amsterdam for how long?
It's already 13 years.
Oh, wow. Okay.
So I actually graduated as a dentist in Athens, in Greece. And then I came here to do my specialization in children dentistry.
Okay. Well, I guess without further ado, why don't we just launch into these questions? When should we start introducing oral hygiene practices to our babies?
So as soon as the first tooth appears, this is usually around the age of 6 months, but every baby, of course, is different. So you have babies with 2 teeth around 4 months old, and others who are already 1 year old and they don't have any teeth. But before children having teeth, you don't really have to do anything. You have enough other things to do as a mom.
What would be the techniques then that you would recommend for cleaning the infant's like gums before any teeth actually emerge?
You can use like a gentle cloth, like a wet cloth or your clean finger, but this is mostly actually to help them a little bit with discomfort if they have some while teething. Before that, it's not really necessary for you to do something. It's not that important.
Oh, okay. What about then you were talking about teething. When we come to like pain relief and management for that teething process, is there any suggestions you can give for that 4 to 6 month period?
You mean when they experience teething and if they experience any discomfort, right?
Yeah.
Yeah, so like I said, you can use a clean finger or you can use like a wet cloth in order to rub their gums and release the discomfort. Yeah, besides that, there are some teething rings. I think you heard about them. Some of them you can even put them in the fridge to cool them, and they can help your baby distract them. I think the most important is hugging with your baby, cuddling with your baby. So whatever you would do whenever you think that they experience some pain or discomfort. And if you really think that they are in pain, yeah, just give them a painkiller if they're older than 3 months old. So just paracetamol.
I kind of love the fact you're a dentist and you're like hugging them is like a pain management for the teeth.
I mean, I'm a mom too. I know that this helps with everything. It's the best medicine.
Well, that's true. So when we're looking at the teeth, the first thing obviously is going to be like this toothbrush. So what kind of toothbrush is going to be best for those very early years, and how often, should we be replacing these at that young stage?
So you need like a soft manual children brush. There are different ones in the market. Some of them, they have also like a handle that a baby likes to hold on their own, or they like to bite on them. I like those. Also, I recommend A brands, and the reason is that they don't, you don't have to change them that often. There's not like a rule, so you change your brush whenever you think that your brush is not doing its work anymore. So when you see that the hair are destroyed, then you should just replace it.
I'm just figuring with the baby, like I remember mine was like just chewing on it. So like after 1 week, it was already damaged. So I was thinking, oh, you have to replace it already.
Yes, then you have to replace it. So that's why I'm telling you, prefer some A brands which will last a little bit longer.
One more question when we talk about these very early stages. What is your opinion? Because that's what we started using before we actually introduced solids. We had this little finger cap thing, these silicone, you know what I'm talking like with the
Yes.
silicone brushes. Is this something that you say this can be used, or is this like totally useless and you would switch directly to a normal toothbrush? Or what's your opinion on those silicone little finger caps?
Yeah, so there's no really evidence that they work in order to clean the teeth. They do work if you want to massage their gums. So instead of using this wet cloth I was talking about, you can maybe use the silicone finger brush. But when the teeth erupt, please just buy a normal soft children brush.
So for everyone out there who's going to be brushing their baby's teeth for the very first time, Kelly, would you actually be able to help us, guide us on this process of what suggestions you might have?
Yeah, you just basically need to create some routine, like with all other things. Baby like routines, baby like to know exactly what is going to happen and when it's going to happen. I would say the most easy technique to brush your baby's teeth will be putting on the baby on your knee with her head resting on your chest. And then you're using the one hand to brush, and with the other hand, you're trying to lift the upper lip of the baby in order to have more control of the head and also to be able to see better where you put the brush. And then, try to make it a game. Try to make your own song, and good luck. Yeah, every baby is different. Yeah, my first one, he really hated it. And the second one, it seemed like he doesn't care at all about what I'm doing, and he's just laughing. And so every baby is different. Keep trying and try to create some routine so the baby knows when exactly teeth are going to be changed. What is mommy singing? Is it before putting my pajamas on? Is it after? That there is an order that makes sense for the baby, and it makes also sense for you.
So I think when we're talking about brushing our teeth, obviously we're going to talk about toothpaste, and something for all of us international families. When we move to the Netherlands, first off, we're going to be in a different country. The brands here are all different to what we know. And so obviously there's going to be a few questions here that I'm sure you probably get asked. I know I've asked my dentist. Are there any specific toothpaste recommendations for like infants versus the toddlers?
Yes, well, the most important thing is that the toothpaste contains fluoride. Fluoride is the only thing that has been proven that it works to prevent tooth decay. So you want that. And then the amount of fluoride in the toothpaste and the amount of toothpaste on the brush are two different things. Let's say all brands, most of the brands, they have two categories in toothpaste. They have the 0 until 5 years old category and the 5 until 12 years old category. So in the first one, the concentration of the fluoride is 500 ppm fluoride, and in the second one is 1450 ppm fluoride. So you would say, okay, I just follow what is written on the toothpaste and I buy this one. But the problem is that only 5 years ago, in 2018, all the guidelines about fluoride and toothpaste have been revised. And now we know that the 500 ppm, so the first category of the toothpaste, is not enough in order to prevent tooth decay. So now brands are trying to make an in-between category from 2 until 5 or 6 years old, which contain 1000 ppm fluoride. So keep this number. I would say find one with 1000 ppm fluoride. Use like a thin smear of toothpaste, so like a grain of rice, as less as you can get from the tube for the babies until 2 years old. from 2 until 5, and you can get the amount of the toothpaste a little bit upper, so like a pea size amount. And then from 5 or 6 years old, when the first permanent molars also erupt, then you want to go to the 6 plus with 1450 ppm fluoride. So for me, it's not important which brand you will choose, but it's important how much fluoride the toothpaste contains. And it's also important that you find one that your child likes and accepts the taste.
I was going to ask about the taste. For example, I think the first toothpaste we got, I don't know, it smelled like strawberry or something crazy. Does flavor have any, can a baby have mint toothpaste, for example, like a 6-month-old? Because mint is quite strong for a lot of people anyway. And mint, I think, was only found in the older category that we got. When this is going out, please check the stories, because there is one very funny Instagram story I'm sharing, because it shows a child having mint toothpaste and they're turning into this gremlin because it's mint and it's just overwhelming the flavor and the intensity in their mouth. Does the flavor actually influence like a baby, like 6 months to 2 years? Are they all going to be like bubblegum or unicorn fairies flavors? Or will there ever be a mint flavor for those kind of toothpastes?
No, I don't think they will be, because from our experience at this age, they don't really like it. So even I have patients who are already 5 years old or 6 years old, and it's very difficult for them to change and start using the second category because of the flavor. The good thing is that there are some of them in the market, some toothpaste without any mint. So you really need to find like the mint-free or menthol-free toothpaste. Or you need to find some toothpaste without any taste, without any flavor. Because there are also children who do not like the sweet taste. So some of them prefer a very neutral flavor without any taste instead of the sweet one. So you really need to see what your child likes. Most of them, they will like the sweet strawberry one. But if you have one who doesn't like sweets, then they can also prefer the neutral one. But I do not know a lot of children younger than 5 or 6 that they like the mint taste. So I don't think also brands will start making any mint toothpaste for these age categories.
I think, yeah, it was 3 to 5 was the age group we're in at the moment, and they're all mint, I think. I can't even remember. And it's just, that journey of trying to introduce it to my daughter to be like, this is how it goes from now on. From now on, it's mint every breakfast and dinner time. I didn't know about the no flavor one. That's interesting.
Yes, there are no flavor ones, and there are also others from 3 until 5 that you can find with tutti frutti taste or cherry taste. So with a sweet taste that the children are used to brush from 0 until 5.
I'm gonna have to Google that one.
I don't think I'm allowed to recommend brands, but it's something you can search. There are, and sometimes you need to find them in a pharmacy or order them online. So it's not always easy to find them in a supermarket, but you can search about them, and because they exist.
That's really good to know. I've never heard of them before. We've spoken about the toothpaste flavor. One thing I've noticed, and actually Maren, funnily enough, had brought it up as well a while ago, electric toothbrushes for children. What age do you think a child can actually have an electric toothbrush?
Yeah, this also really depends on your child's character and temperament. I would say around the age of 3, 4, they mostly like it. But you have children who find an electric toothbrush also very interesting. So even in a younger age, they will like to try it because it's more interesting to them. And you have also older children around the age of 5, 6 who just cannot accept this vibrating feeling on the gums, and they need some extra time in order to get used to them. So it really depends on your child. I would say average around 3, 4, but that's a rule of thumb.
Okay, because I didn't even know there was electric toothbrush for kids until like recently.
We just bought one. We just got one. And when we were preparing for this episode, and I mentioned, oh, I'm so interested to hear her opinion or her knowledge about the electric toothbrush. And then Eva said, yeah, she has a fact about that. And I was like, oh no, we just bought it. Do I need to ditch it now? So far, it comes with an app and it has like a little character which you get rewards after each brushing. So my daughter really enjoys that. So she's luckily for me one of the kids who was super interested in it, and now she asks, well, when can we brush again? When can we brush again? I'm like, well, not too much, but yeah, she's one of the children who really enjoys the electric
Yeah.
toothbrush.
You can even use like the adult one and just buy one of these small brushes because most of them they fit also in the adult brushes. But you know how marketing works, so there's a reason why there are people who created brushes with a figure there, or with their popular cartoon, or one that you can also connect to your mobile. And
I was going to ask.
There's a reason for that.
So you just said you could put another one on the adult one. I was going to ask, is there a different vibrations for the children versus the adult?
Yes, there is. But we actually know that the ones recommended for children around the age of 3, they are not that strong. And maybe it's easier for your child to accept, but we know that they are not also efficient enough. So what we recommend to parents is to just buy a small head that you can actually put on your own brush if you have one at home.
Do you know what? My daughter's not going to ever want a toothbrush because she's going to want me, her little slave, brushing her teeth every morning, every night. It's never going to happen. Anyway, so we've done the electric toothbrushes. Can we talk about the adult topics and if this is applicable to like children, toddlers, children? When we talk about things like mouthwash or flossing or tongue scraping, like, can you give us any suggestions about that?
So I wouldn't recommend mouth washing, and the reason is why is because children, they are not able to spit. So then it's difficult to control the amount of fluoride and the amount of mouthwash that they can drink. So forget about the mouthwash. And it has also not been really proven that it works. Yeah, these all things, also flossing and the tongue scrubbing, they're all bonuses. So for me as a dentist, I would be super happy if you do the basic. Brushing 2 minutes per day, trying to keep the meals to 5 or 6 per day. These are the most important things. If you have the time and you want to floss, be my guest. I would be very happy about it. But it's already too much work in order to be able to brush 2 times per day and to control what your child eats. So start from that. And if you want to add more, you can add them. They're all like bonuses, and they are secondary things you can do, but they will not replace brushing, and they will not do anything if your child keeps on drinking all this like juice packages, 5 of them per day.
One question that I have always asked myself, so my daughter is now 3.5, and I do most like the main cleaning myself. So it's either she brushes first a little, or then I brush, or it's the other way around. But it's still very heavily on my side that I'm responsible for all the cleaning. When is the point where you would suggest that a child has the right amount of motor skills and control that they can actually have more of the responsibility? And for us, it's more like the quick checkup, where now it's the other way around.
I would say around the age of 10.
Okay. Right. Okay. So we have a basic. I was hoping like, yeah, when they go to basisschool, that's
So yeah, my son, my oldest one, he's 4. And now we have this agreement that in the morning he can start brushing on his own, and then I finish the brushing. And then in the evening, I start brushing, and then he finishes the brushes. So, of course, it's important to encourage them to become a little bit more independent, because they also want to be independent. They choose their own clothes, they put their own clothes by themselves, but they cannot be that independent at the age of 4. At the age of 6, then they start also getting the first permanent teeth. And this is a period that is very, very important, that the parents have a critical role in order to brush their children's teeth, because they erupt on the back of their mouth. It's very difficult for the children to reach them. It's even difficult for the parents to reach them. So if you encourage your child to start brushing independently from the age of 4, and then at the age of 6, you want to be in charge again, then you have a problem. So I would say around the age of 10, they can fully be independent and brush their own teeth. But until this age, try to keep some responsibility, because it's very important. They still don't have all the motoric skills in order to do it.
Wow.
Interesting. Okay. Long way to go.
Yeah, long way to go. One part we will always have a role on until they're much older is actually their diet. So I guess we should really tap into this part. What is the role of the diet then playing on like the oral hygiene and tooth decay, for example?
Yeah, so in order to understand that, you need to know a little bit how tooth decay develops. Every time we eat something, we have this acid attack, and then the mouth needs some time in order to recover. If we don't give the chance to recover between the meals, then we get tooth decay. So the recommendations say that children should not have more than 5 or 6 eating and drinking moments per day. So more important than what we eat is how often and how long we eat. So let's say 5, 6 moments. This means for children, breakfast, lunch, dinner, and then they have around 10 o'clock, they have the daycare, also a moment that they eat fruit. And around 3 o'clock, they also have some snack, some crackers. So I would say breakfast, fruit, lunch, snack, dinner. And then you're already in the 5 moments. You can add another one, but just be alert that when your child is eating or drinking something now, wait 2-3 hours until you give the next meal.
So can I just point out, you said food and drink. They're eating 5 or 6 times a day, but obviously our generation are like, our child needs to drink so much, keep the fluids up, don't dehydrate the child. But you're also including juice boxes, juices, like anything that is not water or milk, correct?
Yes, so you include everything there.
So they can only have juice boxes in their snack period or meal periods. They shouldn't actually have that as an additional one.
I would say avoid juice boxes, and I will explain to you why. When a child holds a box with a straw, he's able to drink whenever he wants. This means that children play and drink. So I would say give a glass of juice together with a meal if you want, if your child wants to. And then in all the other moments that the child needs to get fluids, please give only water. So in these bottles that you buy, just fill it up only with water. And this is something that they can always have access to. But I don't want the kids that they continuously be able to drink something while they're playing or while they're doing other things. So you need to keep eating and drinking separate from playing and doing other things. Then it's easier for you to keep this routine and to keep this rule of 5 and 6 moments.
And what do we do with children who are still breastfed or have a bottle to fall asleep? And is it harmful for the teeth? Because I've kept reading that, oh yeah, breast milk doesn't do anything to the teeth, don't worry about it, and the milk doesn't do anything. Is that correct? Or do we need to take other measures than when we are still giving some kind of milk, whatever, breast milk or bottle, to fall asleep?
So in order to answer that, we need to make a separation. So when we talk about babies who only drink milk and do not have any teeth and do not take any solids, they can eat and they can drink as often as they want. But when teeth erupt and when they start also eating solids, then the rule of 5 to 6 moments per day still counts. Of course, breastfeeding, it has all these advantages of the health of the baby. It's the best nutrition that you can give to your baby. It helps with growth. All the antibodies the babies get from the breast milk, they are helping them to prevent from getting sick. It's ideal, but the problem is that from our experience, we see that babies who breastfeed until a later age and they combine that also with solid food have a higher risk of getting tooth decay. What you can do, you can help your child with brushing. So if you brush 2 times per day with fluoride, this already compensates for the extra moments. Try to combine the breastfeeding with the eating moments. So then it's counted as 1 moment and not as 2 separate moments. And try also to brush your baby's teeth before putting them on the bed. And I know what you're thinking now, because of course, as a parent, you are very happy when your child is sleeping. So you don't care if the baby falls asleep on the breast or falls asleep with the bottle. You don't want to do anything. You don't want to touch the baby anymore. But And I do remember with my oldest son how afraid I was to introduce brushing after breastfeeding before putting him to bed. But babies, they're like in a food coma after breastfeeding or after getting the bottle. So sometimes, I mean, that was my experience. What you see is that they will open a little bit the eyes when you put the brush in their mouth. They'll be like, "Oh, hey, mom, what are you doing there?" But then they will still be okay. And then you just put them in the bed and they will continue sleep. So don't be afraid of trying to change this routine. It can be challenging. I know it's a struggle when you have a baby who does not sleep, but try at least to change this order. So you first feed your baby. It doesn't matter if it's breastfed or a bottle. Then you brush the teeth and then you put the baby to its bed. There's even a term for that. It's called baby bottle tooth decay or early childhood caries. And we see that not only in children who drink from the bottle, but also in the babies who are exclusively breastfed. It's about the excessive milk that stays in the mouth in contact with the teeth for such a prolonged period of time. So it's not the milk itself that it will create the tooth decay, but eating on demand, and I'm talking again about babies who already have teeth and who already are eating also solids, it can cause a high risk of tooth decay at this early stage.
And I guess it's also important to still take good care of the milk teeth, right? Because if they get any cavities or any, it can still hurt the permanent teeth. It's not like a free pass of, oh yeah, milk teeth, they're gonna go away. We don't have to worry about them. Whatever. If they get cavities, they're gonna be gone. It's not affecting the long teeth that are staying.
Yeah, if they get cavities and they will be lost and they have to be extracted, yes, you have to go with your child to the dentist. And yes, you wouldn't like a child of 3 years old to get a tooth extracted, right? And additionally, people think that that children start changing their teeth when they're 6, and this is true. But be aware that the back teeth, the molars, they change only around the age of 12. So when we're talking about a child of 3 years old, if they lose one of their molars, it will only grow back around the age of 11, 12 years old.
Ah, right. Okay. And yeah, that's their chewing teeth. So it's an
Yes.
important part of it. Yeah. Okay. So if we look at the older age kids, if we're going into toddlers, so this is something that's in the back of my head for many years ago. Someone said about when you're eating. So for example, crisps, chips, however you want to call them. I can't remember how they're called here in the Netherlands. But someone said if you're going to eat crisps, like you eat them earlier in the day so that you can actually, I don't know, it's better to eat them earlier in the day so they can work themselves out of your teeth so they're not stuck between all your teeth. You know, so are there times a day some foods should be consumed over, you know, last minute at night, you know, when the kids are having their dinner and then they can eat like, I don't know, chocolate or crisps or ice cream or whatever it is? Is there a better time of day to eat certain foods?
No, not really. The most important is still the frequency of the meals.
I'm learning. The frequency, it's just killing me. There goes my snacking.
That's why we have the experts on, right? So we don't have to rely on our opinions and our Googling, but we actually have someone who knows and can let you know crisps are never good.
What's actually worse? Real sugar, like in food, or the fake sugar, like aspartame or things like that on teeth? Which one would be worse?
Yeah, it's again, the answer is it's not what you eat, but it's how often you eat something. So of course, there are other reasons why I would prefer, for example, natural sugars, which you can find in fruits instead of real sugar. But still, it's about the frequency. So for me, it doesn't really matter what you give to your child. Most important for me, it's how often you give something to your child. For other reasons, you would prefer to give fruits instead of candies. But when it comes to teeth, the most important is how often you eat something.
Actually, something there, I think when we spoke previously about doing this episode, you mentioned one thing that you hated above anything else. You haven't mentioned it yet. I'm surprised. What is that thing?
Yeah, well, this is lollipops, and it's everything that stays in the mouth for a long time. So it's a little bit the same idea. when something stays in the mouth for a long time, it doesn't give the chance to the enamel to recover from this acid attack. So please don't give any lollipops to your children.
We're going to get a little bit real here, but there's been some topics on Facebook groups and WhatsApp groups, and personally, one of the biggest dreads that we have as parents is accidents in general. But when it comes to dental emergencies, for example, this is kind of a bit of an unknown because your child falls or falls off the bike, you go to A&E or ER. But the thing is, when it comes to dentistry, you think, oh, they fall, they bang their teeth, and you're kind of like, oh, what do we do? So we have a few questions for you about this kind of specific topic, I guess. As I said, what should we actually do if our child does fall and, injures their teeth or mouth, for example, and it might turn a different color, or their tooth pierces into their lip, or, is there a hint that you could say it's fine, wait, or please bring them? Can you tell us that moment that we should really know about?
So the most important thing is you just call your dentist and you describe what happened, and then the dentist will be able to evaluate if it's important to bring your child to the practice on the same day or maybe the next day, but call your dentist. I cannot give you an advice for all the cases. So the most important thing is call the dentist and explain what happened. If this happens on a time when the dentist is not open, you can go to the emergency, and then they will provide you for some advice for this day, and then they will advise you again to visit the dentist the next day. So call the dentist.
And can you give any common dental emergencies when it relates to babies and toddlers? Because as I said, like most of the common ones I would think of is just falling face forward.
Yeah, so that's the most common thing, falling. Then a few things can happen. So a tooth can be chipped, or it can break. It can even go out of its socket. So the whole tooth can fall. It's important to know that if this happens to a primary milk tooth, you don't have to put it back, because when it comes to a permanent tooth, then you need to put it back in the mouth, or you need to go to the dentist as soon as possible. Keep the tooth inside milk and go to the dentist in order to replace it. But with the primary ones, they don't have to be repositioned in the mouth. So this is something that you should know. But except from that, emergencies, you can have affected tooth, and then you can have a child with swelling and extraocular swelling, which is seen outside in the mouth. Again, call the dentist. Your child can have pain. Call the dentist to go to the dentist to see what's the reason of the pain and how the child can be helped.
Speaking of pain, can you give us an example of some signs that a child will be experiencing dental discomfort?
It's a little bit tricky with children, as it is with all kinds of pain. So children are not able to show exactly where they have pain and how painful it is. So watch for signs like children who are not able to sleep well, children who suddenly will start crying while eating, a little bit of temperature, fever, swelling seen from the outside, also inside in the gums. Always lift the upper lip in order to check the gums of the teeth of the child. But the most important is, if you notice that your child has a different behavior, there's something wrong. Sometimes they're rubbing their ear. Sometimes they can really put their hand in the mouth to show you. Sometimes they just cry while eating. Sometimes they can't sleep and they want to come to your bed. If you notice any change, teeth can also be a reason if there's not any other reason that you can think about.
One thing we didn't touch on is actually when do we expect to bring our child to their first dental appointment?
So when the first tooth appears in the mouth, and then of course the appointment is more about the information you'll get from the dentist. So there will be a lot of talk, and then the dentist will have a quick look, but it's mostly for the parents to get all the advices about brushing, but also about eating. And for the dentist, it's very important to be able to identify all these risk factors which can play a role in order to prevent tooth decay. So during the first appointment, it's a lot about parents, it's a lot about giving advices. All the things we discussed today, they will also be explained by the dentist, and he'll be able to identify any risk factors.
And how frequent should we be then bringing our children to the dentist?
This also depends on the child and what's the risk of developing problems and tooth decay. I have children who come to visit me every 3 weeks, and I have children that come to me every 6 months or once per year. So it really depends on the risk of the children to develop tooth decay.
Because in my
And
head, I
when
thought we just brought them to introduce them to the dentist, and it was a familiarity, and it was building up this biannual, routine. But it's actually serious. We're going in a few days to the dentist, and now I'm kind of mentally preparing now what I have to actually think about.
when we talk about bringing them regularly to the dentist, when does it start that we can have, because I'm just thinking of my dental visits, which is usually when I have a professional cleaning. Is this something that we should be starting with our children? And if yes, what age would you recommend that we start this professional cleaning twice a year with the dentist?
So you start going to the dentist after the eruption of the first tooth. You get all the advices that you need, and then the dentist will explain to you when you have to come back. Maybe he wants to see your child next year. And also it depends on how well you can brush your teeth at home. You can brush your child's teeth at home. It depends on individual factors. It really depends on the needs of every child. So I cannot really give you a recommendation for the interval and how often they should go for the cleaning.
We just want to also quickly cover the system in the Netherlands about the general dentistry and the health insurance. Can you just give us a quick breakdown of that?
Yes, so when the first tooth rots, then make sure you register your child to the general dentist where you also go, just like you register your child to the GP. It's important to know that the basic insurance in the Netherlands covers all the dental care until the age of 18 years old. Even if you don't have a dental package for the insurance, it's covered by the basic one. And then if the dentist thinks that this child needs specialized care, then your child will be referred to a pediatric dentist. And then we're talking about children who are younger than 3 and they already experience some tooth decay, children who are very anxious for the dentist, medically compromised children, and generally children who need some extra care.
And can we also clarify how many pediatric dentists are there compared to just general dentists?
So being a pediatric dentist, it means that you have done also an extra 3-year education after graduating as a dentist. Then you get this title of pediatric dentist, or in Dutch, tandarts-pedodontoloog. And they are around 60 pediatric dentists in the whole country.
60.
Yes.
So there is a difference between a dentist who is open to having children like our dentist versus an actual pediatric dentist. And they really are only for children who really need the help through the different areas that you already previously explained there.
Yes, that's right. But not all children need to go to the pediatric dentist. So it's very important that general dentists are also able and willing to see children and help them, because most of them, they do not need to go to the pediatric dentist.
A great point, because I feel like some people will feel like, oh, they're a child, they should go to this dentist, and they would be probably a bit confused thinking, well, you're a pediatric dentist, therefore you should be having my child, instead of realizing that there's an actual difference here in the Netherlands.
Yes.
Okay, well, I mean, this has been actually quite a lot. And as I said, I am going to the dentist in a few days with my daughter. So this is quite a lot I'm taking aboard. If there's one last thing that you really want parents to take away from this episode, what would you like to share?
Yeah, I would say about tooth decay that it's really like a behavioral disease. So for us as parents, it's easier to prevent when we do 2 things. And this is brushing with fluoride 2 times per day and not letting your child eat and drink more than 5 or 6 moments per day. These are the 2 gold rules that I would like all parents to keep from our discussion today.
Well, I know I have. It's kind of making me crumble inside. I can't do snacking anymore. But well, Kelly, thank you so much for joining us. We greatly appreciate your professional insights on joining us on Damn Parenting. And we really hope this is going to be spread wide amongst our community so they can really understand all this information. I feel like, when we go through the notes later, we write down everything you say and then we go through the notes. I feel like I'm going to have to print it out, stick it into the bathroom and reread it every time. It'll take me maybe 2 minutes of notes taking, and then I can brush my daughter's teeth and read the notes and be like, okay, 2 minutes done. You're gone. Thank you so much for joining us, Kelly.
Thank you.
And yeah,
Thank you
it's
for the invitation.
well, Amy, we're celebrating oral healthcare here today on Wednesday, I think it's the 13th of March. So this was really imperative because it's really a topic that especially first-time parents really are just in an unknown. And it's not just for first, but it will also be for any other second, third, and fourth child. So it's really great. We greatly appreciate this. And we really hope that there's going to be a lot of love and a lot of sharing of this episode so that everyone can hear your message. And no more snacking, people. No more snacking. Thank you so much. Bye.
Thank you.
Wow.
So I guess now we know no snacking.
No snacking.
And fluoride. That's the most important thing.
I mean, I got the fluoride. I think everyone knows the fluoride, but I think it was just the snacking. It was when she was explaining the whole thing of when you're eating, your mouth needs time to change the acidity thing. Never thought of that. I wish someone told me that when I was a lot younger. It was interesting.
Also the whole thing of, I mean, luckily we're out of this part of the parenting journey with the whole night bottle breastfeeding, but I thought this was still super important because I remember this was a question that I had back then. And yeah, it made so much sense. And this whole give the teeth or the tooth a break to recover from their work. I mean, we all need breaks, right? So do our
God,
teeth.
we need breaks.
And that was very, very good to be reminded of. Well, one shocking freaking thing she dropped on us was the 10-year bomb.
Yeah, I thought it was 7, but
yeah.
when she said 10, I just gave up.
Well, good that we know now. Give the teeth a break, brush them with fluoride. It doesn't matter if it's electric or manual. They need to be brushed, full stop. And this is the bad news. You need to be a little behind it until they're 10. So we have a couple of years still to knock in the books, but I was super happy that she came on and cleared a lot of things up. Also good to know that until they're 18, so you have to brush them until they're 10, but until they're 18, they're covered. So it's all right.
That was, and the fact is, even if you don't have your dentist insurance, I did not know that. That's pretty good to know. Yeah, I actually thought it was a really great episode, and I do know a lot of our community have a lot of panic moments when their kid might fall and it's a bit wobbly, or I really was so happy to hear just call your dentist, and if it's out of hours, call the emergency, or wait until the next day, or that I thought was actually really good to hear. I don't know about you, but I actually had a dental incident when I was a child, and it's left me with my dead tooth in front, but it was because I already had the adult tooth in at that stage. And so
that's our twin teeth. Remember,
I know
we have the same dead tooth.
The same dead front tooth. And it's one of those things that it's like, I don't want that for my child because I'm highly aware of it. And that's why I'm so strict with teeth, and I want to make sure she's doing well. But I also, the other good learning part for me was don't give juice boxes out, for example, because they take so long with it, and your bottle should only have water in it because they can drink it as much and whenever they want. That also was a really good takeaway for me, which my daughter's not going to be happy with.
I think this is also then for the parents who working with pouches still or work with them, period, that you can give pouches, but then make sure they don't suck on the pouch for an hour or 30 minutes. It's like, give the pouch, done. So we have a closed event. And one thing that I wanted to say, because that was a question that I had, and maybe some of the listeners were waiting for it, that we address the pacifiers. We did specifically not address this topic because when we had our pre-interview with Kelly, she said, this is really more a topic for the logopedy.
Don't look at me. I don't know the name.
So this is not really a dentist issue or topic, but it's if you take them to the logopedist, then they can address the whole pacifier situation. So in case you were looking for that question, I'm like, okay, ladies, what's going on with that? This is not a dentist topic. We are working on getting a logopedist on so we can address the whole pacifier topic. But I guess with that, happy brushing, happy oral hygiene day, and we'll leave it at that. And I will segue as always into the advertisement part, where you know that every Wednesday we release an expert episode on this podcast, which you can listen to on Spotify, Apple Podcasts, or YouTube, or wherever you get your podcasts. Also on Spotify, We always have a little survey or question that you can answer for us under each episode. If there's anything else you want to share with us, reach out via email or also on our Instagram, which is Damn Parenting Podcast. We're super happy to get in touch with you. Anything else? Oh yeah, Mondays we release our Damn Chats where Eva and I are chatting away about topic that has come up during the week or anything that's on our minds where we say, we don't need an expert. We can just have a casual chat. So that's on Mondays, Wednesdays, the experts. And with that, we will leave it and we will hear you on the next episode. Bye.
Bye.